So scene is safe. We've already been on scene for quite some time, so we've got our PPE, which is gloves and glasses. The patient is unconscious, so the consent is applied. The patient is postured supine. There is adequate lighting, and we have all our equipment set up. So we've got our 14 gauge cannula, we have our one-way valve ready to go, we've got alcohol swabs, and we've got some tape for the one-way valve and to secure it all. And we also have a sharps container present. So we're on scene. We've already identified, probably in the primary survey and rapid trauma survey, that we have a patient with tension pneumothorax. We can see this through the signs and symptoms, which could be shortness of breath, decreased breath sounds. There could be signs of tracheal deviation or distended neck veins. Patient could have subcutaneous emphysema, be hypotensive. There's so many, and we're just going to say that the patient has at least a bunch. So to prepare the patient, we're going to make sure that the patient is on high flow oxygen, which if a trauma situation would be on anyway. So we're just going to get our mask ready. And when the patient is unconscious, we're still just going to explain what's going on for him. There we go. So patient is on high flow oxygen. We're just going to attach that elsewhere. There we go. We're going to attach it to the oxygen. And so what we're going to do, we're going to expose the patient's chest, and we are going to make sure that we have found the site. So what we're going to aim for is the second intercostal space down on the anterior chest, and I'll do it on this side, and the midclavicular line. So we're going down 2 and moving over to the midclavicular line. So now that we've got our site, which is just there, we're going to swab the area. We're going to do this using an aseptic technique, and we're not going to touch the site once it's been swabbed. So just going to, there we go, pop that in the bin, and we're going to allow that to dry. There we go. Okay, so now we're going to move on to the procedure, and what we're going to do is we're going to remove the needle using aseptic technique, and we're going to insert it at the site that we have just found. So it's at the second intercostal space at the midclavicular line, and we're going to insert the needle at a 90-degree angle and just above the third rib. So we're going to go in, 90-degree angle, straight down. We'll probably hear a pop or a hiss, and then we're just going to slide the needle out and off, no advancing, and then we're going to pop the needle into the sharps container and attach the one-way valve to the end of the needle. There we go, and then we're just going to tape it so it's nice and secure, and then we will monitor the patient.